Welcome to your CBC orientation. The purpose of this video is for you to watch it the day before and the morning of your CBC so that you have a refresher on what's going to be expected of you on your exam day. Now, a CBC can be a little bit overwhelming, but realistically it's very similar to what you do on a normal clinic day. The first thing I want to review with you is your paperwork. The paperwork is critical in the sense that you do get graded, whether you do it correctly or incorrectly, so it is important that you feel comfortable with it so you know what you're supposed to write down and where you're supposed to write it. So we're going to go ahead and get started. When you walk in on the day of your CBC, you're going to be handed a packet. Okay, the packet has all of the applicable documentation that you're going to need for that exam day. We're going to go ahead and get started with the first document that you're going to go ahead and fill out. The first document is going to be your EO-IO form. The EO-IO form needs to be completed in its entirety, which means if you are not seeing something related to each one of the categories, then you need to denote WNL with the normal limits. However, it's important to recognize that if there is anything there. So if, for example, under head, face, and neck, if you are noticing any sort of like an infected piercing, something really minimal, or if you're noticing something like tori, you need to write that down and then not write WNL. So the WNL is only written down if there is nothing evident within that category, okay? At the top of this, please put the chart number for your CBC patient, your box number, and the date, okay? The next form that you're going to complete is going to be the Clinical Board Competency Assessment form. You need to make sure that you complete your box number, your chart number, chair, and date. You're going to complete your health history and your anesthesia, and then you're going to document your calculus where you found it, okay? What I really want to emphasize here is your anesthesia. You need to make sure that the type of anesthesia, the anesthetic agent that you're using, as well as the injection, your cartridges and your milligrams, and which quad you administer it to needs to be documented. Please make sure that with the agent, you put lidocaine, if that's what you're using, or xylocaine, with 1 to 100,000 epinephrine. If you do not put the 1 to 100,000 epinephrine, you're going to lose points for that, okay? It needs to be very, very thorough. About 80% of students are going to miss some sort of points for documentation, so it's very important that you are really thorough about this, okay? At the bottom, we are going to go ahead and fill that out as faculty when we check you in, so you don't need to worry about this section down here, okay? The next form that you're going to complete is going to be the triplicate form. You are going to write only on the white sheet, okay? There is a yellow and a pink sheet here. You're only responsible for writing on the white one. However, please make sure that you don't write anything on top of the triplicate form. So for instance, when you're filling out your assessment form, don't do so on top of the triplicate form because it's going to bleed through onto the triplicate form, and then it makes it really hard for us to kind of read through the form. On the triplicate form, you're going to again put patient chart number, date, and box number. You're going to put the option that you have selected, whether that's one quad, maybe you want to submit a second option, maybe a quad plus a couple teeth. And then you're going to go ahead and put your probing depths and your recession in the correct spot. Okay. What I really want to emphasize here is the fact that if you do not complete your recession, if you do not denote that there is 0 millimeters of recession, you're going to get marked down. So if you're doing a whole quad of 6 to 8 teeth with 2 surfaces each, if you do not put 0 for recession, that could fail you right there. So please make sure that with your recession, you're putting 0 or the appropriate number. Okay, probing depths, obviously you're going to get a probing depth for that. but also make sure that you're not choosing 1 millimeter pockets for interproximals on molars. Realistically, this is a CBC patient. They're going to have moderate to heavy subgingival calculus. There's going to be inflammation. There's probably going to be some bone loss. So realistically, we should be looking at least 3 millimeter pockets interproximal, more likely 4, 5, or 6. Okay, so be realistic about your probing depths when you're going through there. The next sheet that we're going to go over is your post-op instructions. I'm not going to spend a lot of time on this. You should already be giving this out to your SRP patients. You're going to give this to your patient when you're done. Your next paper is your post-CBC. What's important about your post-CBC to recognize is that your CBC is not complete until this is completed, okay, in its entirety. So it's very important that you complete your post-op CBC in order to get complete credit for your CBC exam. Now, the post-op CBC, we may be able to complete that day that you took the exam, as long as we have time. Your faculty is going to tell you specifically when they bring you back in, hey, you've got time, let's go ahead and complete your CBC, your post-CBC, and at that point you can go ahead and do so. Finally, you're going to have your little tissue note. This is something that will be returned to you when you are going to come in after you've completed scaling and you're requested to come back in to meet with your patient and review any areas of tissue trauma. What is important to know about this is that just because there is a tooth and a site written down does not mean it's concurred. What that means is, do not panic if you get the slip back and you have 2 spots of tissue trauma. This just means that at least one faculty found that spot of tissue trauma and they want you to go back and evaluate the area, okay? So just because you get this back when you walk in does not mean that you have lost, 2 or 3 points, or 2 or 3, it should be 5 points each, but, 2 or 3 sites of tissue trauma. Okay, so that is it for the paperwork. Again, please make sure that you're very thorough with it, that you complete it in its entirety. When you walk in and you get your packet, you want to make sure that you have all of that documentation, and when you are completed at your first hour and you submit your patient, you want to make sure that all of that paperwork is completed in its entirety. What I would recommend that you do is within your first hour, save at least 5 to 10 minutes. 10 minutes might be pushing it for most of you, but at least 5 minutes to go through the paperwork. You want to do that so that you're sure that you've answered all of the questions and you know for sure that what you've done is correct. Okay? You're going to go ahead now and watch the second part of this video, which is going to be the actual step-by-step breakdown of how to go through your CBC.